think my inspiration for family medicine was the fact that I can do different types of specialties in the medical field, whether gynecology, you could do geriatrics, you could do sports medicine. It gives me the freedom to focus on something that I really love in that field, or I could do a lot of different things, whether it's pain management, whether it is sports, injuries, geriatrics. We could do lots of chronic diseases. You kind of know a lot about everything. Well, you kind of know a lot of things and, just enough on every single topic. I like to avoid referring patients out. As you know, managed cares, we tend to focus on saving money, not spending money. So that's the main reason. And what keeps me going every day is honestly my patients. There's some gratitude or satisfaction that you get from patients when they do better, or they change their life, or they become happy, and or they become ill and heal. So that's the main reason why I do what I do. That's a very good question. I think the majority of my patients usually leave an impact on me, but one specific person was I was a 30-year resident, and we're in the ICU. There was a code, patient code. It got called into the ICU, and I had to intubate the patient. Patient was a 23-year-old young man on dialysis, really sweet guy. He wasn't doing that well. I ended up intubating him, but during the intubation, he was still alive and awake. He had a pulse, but he was having difficulty breathing, so we had to intubate him. And during that process, he kind of gagged before I even put in the tube, and he had a huge stomach bleed. All of the stomach contents came out into my face. I'm talking about in my mouth, my eyes, and let's just say that during that time, I didn't have time to think about what just happened. All this bodily fluids are in my face and my mouth. We had to save the patient. I ended up intubating him, and the intensivist at the time was also there helping me, and the patient recovered very well, and I saw him a few days later in the ICU. And just to see his smile when I walked into the door reminds me that no matter what struggles we go through as doctors, it's worth every second just seeing a smile on that patient's face. And that's a story I typically won't forget. There's a lot of them in medicine, unfortunately. A lot of challenges financially, mentally, physically. I think the biggest part was my board exams were really hard. I had a family, my kids, and we were moving a lot. Financially, we weren't doing so well. I had to ask my father for money at times. And then I also, during this process, I've been practicing for about 10 years now, and I had separated from my ex-wife, and we had a divorce. We were having problems, and my kids and I really don't talk much except for my 9-year-old. I think this is the biggest challenge that I have is, no matter what you do, sometimes life takes you in different paths and changes, and you lose loved ones. And the process to find a better path for yourself and for you to be happier. I'm the type of person that I normally don't regret my decisions at all. And I don't regret this decision at all, but that is something that I decided to do. That was very hard for me, just to choose a different path. But I love what I do. Every single day I wake up with a smile on my face and love to see my patients. Well, I think there's two aspects to it, right? As a primary care physician, you really need to have a good kind of connection with your patients. There should always be a professional barrier or a line that you do not cross as a physician, because we are still professionals, and patients are, whether it's HIPAA, whether it's compliance, you need to make sure that the patient is healthy and happy first. But second of all, if you develop a really good relationship with the patient, I personally believe that you treat the patient better physically, health-wise, because you know the patient very well. You could take a best example, you can become friends It doesn't mean that, you have to hang out with them outside of this, the office, but you can become friends and ask the patient about her son's wedding, or her granddaughter's graduation. There's nothing wrong with kind of being a little bit more personable with the patients. I think the psychosocial aspect of medicine is probably more important than the actual medical part, because if you care about the patient, you will treat them better and they will heal a lot faster, especially when they trust you. But try to never cross that line, and a lot of physicians know what that line is. I think that the most important thing is you have to be a really good listener. A lot of doctors don't listen. A lot of doctors look at patients as numbers, in and out, and listening. So if you are interested in the field of medicine in general, you really got to care. You can make money thousands of different ways, but to actually truly care will make your life so much better, so much easier. And of course, you'll be more successful because patients will trust you, and you'll get a lot more patients to come see you. That's a very good question, because I don't think there's an answer to that, but I will tell you one thing. The secret to balancing that is, as soon as you leave your office, you have to remember that you got to leave it behind you. No matter what happened in the office, no matter there were patients upset or patients that got sick, you have to balance that, and that will take practice. Initially, it will be very difficult. There will be days, there were days I'd go home crying, just stressed out about a patient. Did I write the right medication? Did I do the right thing? But no, you leave it behind you. Don't think about it. Don't worry about it. Tomorrow's another day. You move on. Well, I mean, there's different, aspects to it, whether it's financially, emotionally, physically. Financially, I think the medical field is one of the highest paid fields there is, that's kind of very rewarding. But at the same time, we are healers, right? Yes, God is the Almighty, the healer. Of course, he's the one that really takes care of everybody. But the reality of it is, we're kind of like the messengers, where we heal patients. They get sick, we treat them. And you'd be surprised on how many people you can save. As a clinician, I've saved so many people from dying. And that is the most rewarding part, to be honest with you, because there's no better feeling than just seeing the patient survive, a critical situation, or recovering from cancer in remission, pain, controlling pain, and now they're relieved of their pain. So that is actually the most rewarding part of it, is to see the patient smile. I think I'm at that age where computers and the internet and AI has kind of been a part of our lives in general. So for me, it was kind of just easier and more fun to have technology and to use technology. I think it reduces a lot of errors, and we're human. Doctors make errors. But at the same time, the speed, the process makes it a lot faster, where you're able to treat more patients. You don't have to spend as much time. People don't realize that if you just listened very well, you don't have to spend that much time with the patient. And then we go back to the other questions, where we know that patient-doctor relationship. If you know your patient well, you don't have to sit there and worry, because you know them, their past medical history, their past surgical history, etc. But technology has helped big time, and I think it's only going to get better. That's a great question. I think that what I would change is the insurance companies. I think the insurance companies are a disaster. Prior authorizations, peer-to-peer references, and we have to go through hurdles just to get an authorization for a CT scan. And the worst part about that is, these people don't know our patients. They know, literature and books and what they read on, but they don't know the patient. They don't know what the patient's going through. So, but I understand there are a lot of doctors who over orders too many things. And sometimes it's just ridiculous. But at the same time, I don't need to go through 7 obstacles to order an MRI of the brain for one of my patients. And honestly, the insurance companies is the biggest problem that we have. Now, I'm not saying we don't need insurance companies. I'm just saying that there has to be change. Make it a lot easier on the patient and make it a lot easier on the clinicians, because they are getting burnt out. I think with our busy lives, a lot of people are unable to leave their work. A lot of people are working 2 jobs, sometimes 3 jobs. Some people have families, some kids, that they're unable to leave the house. I think telehealth is fantastic. Now, I don't think that's the best approach, but if you were to ask me about a telehealth visit versus no visit at all, I will do a telehealth visit. At least we're able to see the patient and discuss it with the patient. You see what I'm saying? So that's my recommendation. Is I think it'll help us more than anything. I think that patients, if I had to ask one thing to my patients, is understand that we're human also. We get tired also. We make mistakes. We're not perfect, but we really care. I love my patients dearly. I will do everything I can in my power to make sure that they are healthy, that they live long and prosperous. But at the same time, we're also human, and we become weak sometimes. We get stronger, we move on. So find a doctor that cares, find a doctor that listens, and you'll be happy.